season. Let's go to Edmund in Chicago and finish it up. Hey, Edmund, are you still with me?
Yeah, I'm here.
All right. So interestingly enough, there's a type of dizziness which is referred to as Wallach's vertigo. It's actually named in the diagnostic books after Dr. Joel Wallach, the founder of longevity. Dr. Wallach knows more about the pathogenesis of vertigo than dizziness than anybody else. So, you know, the first thing to consider when somebody has heartburn is that their stomach acid is too weak. The first thing to consider when somebody has high blood pressure is they don't have enough calcium and magnesium in their blood. The first thing to consider when somebody is dealing with vertigo and dizziness is chronically is that they have a condition called osteoporosis of the skull, which sounds a lot worse than it is. But there are nerves that go to your eyes, ears, nose, mouth, and throat directly from the brain. And to get to the eyes, ears, nose, mouth, and throat, they have to go through tunnels in the brain. And those tunnels are called lacunae because, remember, the medical doctor is so full of himself, they just couldn't call it a tunnel in the brain. They had to call it something fancy schmancy. So there's a tunnel in the brain or in the skull that the nerve from the brain goes to, in this case, to get to your inner ear. And it's your inner ear which regulates your balance and your sense of position in the world. Now, when your inner ear is messed up, your balance is going to be messed up. So when that little nerve goes through the tunnel in the skull on its way to your inner ear to help with your balance, if that tunnel starts to collapse, the body knows that that's not good, and so the body will put connective tissue inside the tunnel to keep it from collapsing all the way, because if that tunnel collapses, then the other ones are going to collapse, because the only reason they do collapse is because of structural, it's a structural integrity thing. It's kind of like if, when the bridges start to corrode and they start to rust and they start to bend and the concrete starts falling off, it's just because they haven't been maintained properly. Well, when your skull bone doesn't have enough nutrition, the body will put connective tissue inside the tunnels, and if it's the tunnel that the nerve that goes to your inner ear is in, when that connective tissue rubs up against the nerve, it creates dizziness. If it's the nerve that goes to your eardrum, if it rubs up against it, you get ringing in the ears. If it's the nerve that goes to your eye muscles, you get a lazy eye. If it's the nerve that goes to your voice box, your vocal cords, you get chronic voice trouble, hoarseness, laryngitis, and so forth and so on. So second and third thing to think about here is this is osteoporosis of the skull. What causes osteoporosis of the skull? Well, your skull bone has run out of the nutrients it needs to maintain its integrity. And you're probably unwittingly used to be, maybe still are, eating food that's hurting the skull bone health. And guaranteed, if the skull bone is this bad off, then there's some other type of arthritic problem going on someplace else in the body. So do you have low back pain or knee pain or shoulder pain or any type of joint pain of a chronic nature anywhere else in your body?
I had a double knee surgery, so I do have a little bit of pain in my right knee, and then my right lower back, and then my right shoulder as well.
Yeah, okay. So that's all nails in the coffin that this is chronic undiagnosed, because your medical doctor, I swear to God, they have if we did an MRI on 100 medical doctors, 99 of them would have brains the size of a freaking lentil bean. It's amazing to me that they were even able to pass medical school, for goodness sake. So here's what you need to do,
quick
please.
Question for you.
Yeah, I'll tell you what to do. Yeah, go ahead.
When I notice the dizziness come is like just before I have a bowel movement.
Yeah.
I have no idea. Is there a connection? Or?
Yeah, there's a connection. It's because you're bearing down, and everything in the body is connected, and there's like your body is it's like kind of it's like a garden hose, man. And when you squeeze on the garden hose on one end of it, the water's going to come out faster on the other end. Or if you squeeze it too hard, it's going to back up behind it. And so when you're bearing down to have a bowel movement, it's going to increase intracranial pressure, and that's going to rub on the nerve more, and that's why it's going to increase. I mean, it's pretty straightforward to me. Why more?
Even before that, I'm saying. Like even before.
Well, all right, so stick around. All right, stick around. We're up against the hard break.